I've been through hurricanes plenty of times. And before Harvey, um, I thought, okay, no big deal, life goes on. And then my house flooded.
COVID-19 is a hurricane.
My family and I had to literally walk out of our house through floodwaters.
A hurricane Dr. Troy Fiesinger says we can't see.
And it's been a month. And we're not even at the floodwaters have receded stage where we can start rebuilding.
The virus is an invisible flood. The flood Dr. Fiesinger can't stop.
Coronavirus has affected every single aspect of our practice and our patients' lives.
The disease is a challenge unlike anything the longtime doctor has ever experienced, even during the AIDS epidemic.
But we knew how to handle that. We always had all the equipment we needed, even at an overburdened county hospital. This epidemic is far scarier.
Dr. Fiesinger works for a chain of 15 clinics across Houston Metro. They do house calls for the elderly, frail, and sick. He says his team has to choose who is sick enough to get an immediate visit because the clinics don't have the proper supply of the personal protective equipment, like gowns and masks, to safely treat everyone who needs it.
It's incredibly frustrating. It's not at all the way I want to practice medicine. I've never had to triage patients in this way, ever.
The shipments have been delayed, though gowns are expected this week.
All we're asking for is the tools and equipment to do our jobs. I think there's a failure of executive leadership at the state and national level, and a failure to coordinate the response in the way it needs to be coordinated. And if we're talking about relaxing restrictions or reopening the economy, fundamental question has to be asked: how many lives is the economy worth?
I'm Anastasia Bolton.